Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's weekly COVID news conference. I am Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honourable Andrew Furey, Premier of Newfoundland and Labrador, the Honourable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador COVID-19 update for today, Monday, November 30th, 2020. As Premier, the health and well-being of Newfoundlanders and Labradorians is my top priority. As MHA for Humber-Gross-Mourne, I've been closely connected to Mayor Dean Ball and the Deer Lake Town Council, as well as Education Minister Tom Osborne, as the community there deals with their COVID-19 cases. As a father of 3 young children, and as a husband to a doctor on the front lines of the healthcare system, I am keenly aware of how important COVID-19 decisions are. It's personal for me, as it is for all of us at this briefing, working to help protect Newfoundlanders and Labradorians, as it is for each and every one of you at home. Each day lately, new cases of COVID-19 are announced here and across the country and around the world. And it may feel like we're slipping back to March, and seeing the spread of virus in many parts of the country may increase anxiety levels here at home. But it's going to be okay. Please don't panic. Take a deep breath and stay calm. We are focused on avoiding a full lockdown here in Newfoundland and Labrador. This is where you come in and have a big part to play. You have to follow the rules, no matter who you are, and to focus even more on what you and your family are doing, as opposed to what others are doing. That's how we avoid turning into a COVID-19 hotspot. Wear your mask, wash your hands, and keep your distance. You must listen, Newfoundland and Labrador, now more than ever before. With that, I'd like to turn it over to Dr. Fitzgerald to share today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media advisory yesterday, we have 1 new case to report. The individual is a female in the Eastern Health region between the ages of 20 and 39 and is a close contact of a traveler. We had announced 1 case yesterday, a female in the Eastern Health region between the ages of 40 and 49, where the source was under investigation, and we have now confirmed that that source is travel related. The total number of cases in our province is 338, and we have 1 recovery today in Eastern Health. To date, 298 people have now recovered, and we have 36 active cases. In total, we have tested 62,521 people. Tomorrow marks the first day of December, and for many people, this begins an exciting countdown to Christmas. My countdown is a little more of an apprehensive one, and I know that many individuals will be returning home to the province this month, whether they be students, seasonal workers, or individuals reuniting with partners and children. Inevitably, we expect to see more cases of COVID as a result of travel into the province. For travelers and their families welcoming them home, please remember that travelers must adhere to the 14-day self-isolation requirement. As a reminder, if someone is self-isolating in a house with others, use a separate bathroom and bedroom if possible. If it is not possible to use a separate bathroom, it must be thoroughly disinfected after each use. Avoid close contact within 6 feet with people who are not self-isolating with you. Ideally, you should be in a completely separate area of the home and not be in common areas of the home. This may mean having meals delivered to your door. Do not use common items with others in the home, such as serving utensils, and any common touch points, such as doorknobs, should be disinfected after use. No visitors should enter a home where someone is self-isolating, and if someone in the house becomes symptomatic, everyone in the house must self-isolate. Please also remember that if families decide to self-isolate together with a traveler, they are not permitted to leave the property for a full 14 days unless urgent medical care is required. I would also like to remind anyone looking to travel to or from the province this year that only essential travel is advised at this time. As well, our new travel form will be going live on our website tomorrow for those who are looking to come to Newfoundland and Labrador. This form will provide a faster and more efficient process for both travelers and border officials. I continue to hear of parties being planned for Christmas and New Year's Eve as if this year is the same as any other. It is not the same. This year is very different. I think that there is a misconception among some individuals that COVID is not in their community or social circles, simply because we do not yet have any evidence of community spread. But COVID can be anywhere at any time, and a Christmas party can set up the perfect conditions for that to happen. Please continue to be mindful of people, space, time, and place. To be clear, small gatherings with close, consistent contacts is acceptable. A party with 50 people is not. Please remember 20 for 2020. The fewer contacts you have, the less opportunity the virus has to spread. So please maintain a consistent, close group of contacts over the Christmas season. Gathering spaces should be large enough to allow physical distancing, and let the size of your space determine how many people you can safely accommodate. If you only have room for 10 people with physical distancing, then 10 is your maximum. If you host a small gathering, ensure your bathroom is well stocked with soap and hand towels. And if you are sick, stay home and do not invite others to come for a gathering at your house. Please remember that the risk of infection of COVID-19 increases as people spend longer amounts of time together, and spending time together indoors is more risky than time together outdoors. If you haven't already done so, please download the COVID-19 app on your phone. This app will notify you if you have been in close contact of someone with COVID-19. I encourage employers to find alternative ways to recognize their employees this Christmas. A Christmas gathering may inadvertently put your employees that are likely not close contacts within each other's bubbles. After all the effort that employers have put into ensuring safe work environments, it would be unfortunate to undo all that good work for a Christmas party. For restaurants and bars hosting formal or informal celebrations, please ensure strict adherence to the public health guidelines for the health and safety of your customers and staff. I also think that guidance around shopping bears repeating. Sanitize your hands upon entering and leaving the store. Stay 6 feet away from others. Remember that your mask does not replace physical distancing. Avoid crowded areas of the store. Getting that item on sale or the last cooked chicken is not worth risking your exposure to COVID or any other virus that keep you sidelined this Christmas. Respect directional arrows where aisles are marked as one way. As a recap, for those who may have just joined, we have 1 new case since yesterday's media advisory, and the total number of cases in the province is 338. We continue to hold steady and avoid the COVID trajectory that has taken a hold across our country. This is not luck. It is a result of layers of protection that we have built from travel restrictions, self-isolation requirements, distancing, masking, staying home if you're sick, and following personal public health measures. It is because of the perseverance and sacrifice of the rotational workers who must leave the province to provide for their families. And it is because of you, the residents of our province, who have been diligent in heeding public health advice. I thank you all for getting us this far and ask you to keep up the good work. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. Many times we've talked about how fortunate we are to have intelligent, hardworking, talented Newfoundlanders and Labradorians working on our pandemic response here in the province. They, like me, follow scientific evidence and best practices, peer-reviewed research, and make decisions accordingly. Professionals like Dr. Natalie Bridger, who I'm very honored to call a dear friend. Dr. Bridger, an associate professor of pediatrics in Memorial University's Faculty of Medicine, is currently being recognized for responding to the COVID-19 pandemic in a heroic way with the Pediatric Chairs of Canada 2020 Leadership Award. And Dr. Bridger noted part of what's so important about her work is that she feels that she's helping navigate through a sea of misinformation. That's right, a sea of misinformation. So I'd like you, Newfoundland and Labrador, to think of Dr. Bridger as rumors and theories swirl, as they inevitably do, throughout your own communities. Focus on the clear, solid information coming from public health officials and other trusted sources. Misinformation during a health crisis can actually cause harm, put people at risk, put their lives at risk. So there's no place for it in our province. Never has and never should be. You have to recognize that the highly skilled, trained professionals are working for the benefit of everyone, Restrictions are in place to help keep people safe. We need to accept that we may continue to see travel-related cases over the next little while, as Dr. Fitzgerald just said. But with proper protocols being followed, those cases should remain as they are, traceable, connected, and not spread through community transmission. The only way we can achieve this is by everyone following the rules and trusting the experts, not the keyboard warriors spreading falsehoods and misinformation on social media. Everyone's an expert. Stay safe, Newfoundland and Labrador. Take care of yourselves and each other. I'd like now to ask Minister Haggie to say a few words.
Thank you very much, Premier. It is day 268, and we fortunately have only one case today, which is an improvement over the weekend. And again, I echo Dr. Fitzgerald's comments about it being a testament to the hard work of the individuals here. I think it is worth looking at our numbers in terms of the concerns that people have. We've seen a low over the summer of no cases in June, and then single digits. And then suddenly in October, we saw 17. And this month, as it comes to a close, so far we have 47. Nowhere near the peaks of March of 162. But again, a warning to us all to hold fast, as Dr. Fitzgerald would say. The cases, as have been described, have all been associated with travel or contact with known cases. But I do get questions from time to time when we label a case as being under investigation. And to draw on the Premier's comments about misinformation and speculation, it is around these where, certainly on my social media feed, you see a very mixed range of comments, some of which are really quite nasty. For us, under investigation simply means that in the interest of being prompt with our notification, there have been days when literally within 20 minutes of producing our press release or coming into this venue, we hear of another case. We label that as under investigation and provide no more information, not because we're trying to hide anything, but simply because we do not have it. Investigation is a discussion between a trained contact tracer and the individual concerned. And it is only when that has been evaluated that we can then classify the source of the infection. And thus far, the important thing is that we have been able to find how these individuals have become positive. Of note, several of these have come forward because they in turn have been notified by the COVID Alert app. It is starting to bear fruit, and it is starting to work for the people of this province. And I would encourage you again, if you have not done it, download it on your phone and activate it. So again, the issue of travel comes up in the correspondence and the comments I see on my Facebook feed and social media. Travel has never been prohibited in terms of Newfoundlanders and Labradorians coming and going. There are requirements for returning Newfoundlanders, but we have never felt the need to forcibly limit travel. Indeed, we weren't sure at one stage whether that would be actually possible. Dr. Fitzgerald always made it quite plain that essential travel is what matters now, not discretionary travel to Mexico for a vacation or for some social activities in another province. We still see people coming in from outside of the province on exemptions. These exemptions are granted by public health on the basis of very specific criteria. For example, providing care to an elderly relative or someone in distress. We will allow that through Dr. Fitzgerald's special measures orders. End of life and palliative care are other occasions which have been very emotional and quite understandably so. And we have done our best within the framework of COVID safety to permit these visits to occur. We also have a need for maintenance and rehabilitation sometimes of specialist equipment in the province. We have, for example, a state-of-the-art radiation unit at the Bliss Murphy Centre, which will need a new isotope container fitting. That can only be done hands-on by people from outside the province. They will come in with appropriate precautions, do the work that is needed to provide cancer care for patients in this province, and then leave. And Dr. Fitzgerald, myself, and the Premier have often referenced rotational workers who, by nature of their job, work in other jurisdictions in protected environments such as campsites. And we have done what we can to make their lives less difficult during this difficult time. We are where we are today with our figures because of the hard work of Newfoundlanders and Labradorians. The success in the numbers is the success of everyone who's made the effort. I looked around the stores in Gander this weekend, counting people in, people wearing masks, standing on the dots and avoiding long contact at close range. The Avalon Mall, I hear, was an example of how well this can work over the weekend. So again, hold the line. One of the seasonal comments that I get in my email, and I had another email today, relates to the issue of the traveling elf on the shelf. And I have consent, so Dinky can travel if he is an essential traveling elf. There are, however, different jobs for elves, so some may need to isolate. And I would suggest you discuss this with your elf before coming to any premature conclusions. But in the words of Dr. Fitzgerald, these are essential workers. So on that slightly more seasonal note, Premier, I'll hand it back to you for the rest of the event.
Thank you, Dr. Haggie. From the shelf, I suppose. I guess we'll open it up to questions from the media at this point.
Thank you, Premier. For the benefit of our speakers, there are 4 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any final questions. Our first questions are from Peter Cowan with CBC. Please go ahead.
We're seeing, it's not just travelers, like the case today, we're seeing close contacts of travelers who are testing positive. Nova Scotia has said those travelers need to isolate in their own space. It needs to be a separate accommodation, or if they are isolating, their family has to as well. Why aren't we doing that here?
So we do say that people are supposed to isolate away from each other, and that if you are here, you have to isolate away from your family. I just went over that. So that is the recommendation that we are making. Sometimes for reasons that may be, significant, that people are not feeling that they can do that, and so they isolate together. But if they do, then the whole family has to isolate.
So what do you make of the cases that we are seeing where we're seeing contacts testing positive? Because is that a sign that people aren't isolating enough, or is that just the nature of the virus, that it is very contagious?
So I think it's a little bit of both. I think in some situations, people weren't isolating because they weren't required to. And then in other situations, sometimes people may not have been aware that they were supposed to isolate. And so we saw that contagiousness happen. And then I think in other times, in other situations, it may very well be because of the nature of the virus and the situation of the time. So it's very much, I guess we'd have to look at each case on a case-by-case basis, but there are a number of reasons why that could happen.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. We have a handful of restaurants now that have been reacting to possible exposures, shutting down, etc. Is it possible that we may take a cue from Nova Scotia and start posting locations online of potential exposure?
So if we felt that there was a significant exposure in a restaurant or other public place, then certainly we would post that. Those decisions are, I certainly would rely on the regional public health teams who do the investigations to determine if such exposures would be deemed significant enough to warrant that kind of notification. Up to now, that hasn't been the case. In a couple of situations we have in the past had to do that with regard to potential exposures. So if it was necessary, we absolutely would. We just haven't gotten to that point right now.
Okay. And for such an establishment, if they're trying to, exercise an abundance of caution, how long would you say they really need to close for cleaning. I'm thinking that the spread through fomites is not nearly as bad as we originally thought. So is it really necessary to close down for a significant period of time?
So what we know about this virus is that it generally spreads from person to person through fairly close contact, extended contact over a period of time, right? And so generally speaking, you're going to, if you get the virus from someone, you're going to get it directly when you're in their presence. The risk of fomites, as you said, is not quite as much. So as long as the restaurant was thoroughly cleaned, I think especially high-touch surfaces, tables, chairs, doorknobs, rails, that sort of thing in the washrooms, if that was thoroughly cleaned, then once the person has been out of the restaurant for a period of a couple of hours, the risk is quite low for transmission within the restaurant situation. The risk is highest, of course, when the person is actually in the restaurant, and that generally, for the most part, is not something you would know until a later time when the person is diagnosed.
Thank you.
Our next questions are from Linda Swain with VOCM. Please go ahead.
Good afternoon. Many provinces laying out their plans now for distribution of the COVID vaccine. Ontario, for instance, promises to have their system ready by December 31st. Have we set any timelines here yet?
We're still working with all our partners in Ottawa and waiting to see exactly, working with them to see what they're exactly offering and integrating this with the plans that we've already had here. So we expect to roll something out within the next week or 10 days or so.
Last spring, a lot of elective procedures were postponed in the healthcare system due to COVID-19. Are there any plans to do so as the numbers ramp up? And what kind of what kind of numbers are we looking at in order for that to be affected again?
Dr. Haggie,
from the point of view, Linda, of the backlog that was generated, as I say, we are working in most areas of acute care now between 96 and 112% of the level of activity we would see for the corresponding period last year. The exact numbers, as I say, were very difficult to get hold of because outside of the 2 weeks that the RHAs were notified about, the other waiting individuals, those names are held through the physicians' offices. So we're working with the NLMA to try and identify those and quantify them. In terms of going forward, we do have the ability to, through the RHAs, to reduce or eliminate varying degrees of urgency of procedure. Unlike other jurisdictions, we did not ever stop cancer surgeries or emergency surgeries, and there's no plan that we see where we would do that in the foreseeable situation rolling forward.
Of course, I can comment even a little further there. During the early days of the pandemic, I was still in the healthcare system and on the COVID unit a couple of times, and since coming out of the healthcare system, I've asked those questions as well and been reassured the capacity exists currently, even looking at the epidemiology across the country. I think Newfoundlanders and Labradorians would be incredibly proud and should be proud, and the leadership at the regional health authorities should be applauded for the way that they pivoted in terms of supplying COVID units in very short order and maximizing the COVID a friendly environment, if you will, throughout the hospital in order to kind of maintain capacity moving forward.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Wanted to touch on the travel criteria, the new procedure that's going to be going live tomorrow. The allowable reasons for travel to the province, are they actually new, or are these just a clearer definition than what was previously in place?
No, these have been the criteria that we've been using all along. So there's nothing any different there than what we've been applying up to this point.
Okay, and why is the province going to this system now?
I think it's just for ease of ease of use for people who are traveling in, but also for our exemption team, as well as for the border officials that are meeting people at points of entry. So I think it facilitates the whole process for everybody, and it allows us to just keep track of things and in a very efficient way.
Thank you.
Kellyanne, we brought in a lean black belt, I think is the expression, from Eastern Health to look at the process around exemptions, and this new approach reflects that input in terms of, as Dr. Fitzgerald says, making it more efficient, but also it will be electronic and entirely searchable. So some of your questions around, what categories of individuals are coming, what our numbers are on a day-by-day basis, and any trends will be much more easily answered.
Awesome. Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
I want to follow up on the mention of the COVID app that Minister Haggie mentioned there. Can you give us an idea of what the uptake is from, as people are testing positive, how many of them have the app in order to enter the code and send out the notifications, and how many people have we seen coming in to get tested because they've gotten that notification?
The short answer is the broader question can't be answered. The app was built in such a way that we don't even know if someone uses the code that they get until they actually present with a contact downstream. It was done in such a way through consultation with the privacy commissioners that this is totally decentralized. The information is held on individuals' phones and nowhere else. In terms of how many people have triggered a test because of an alert from a COVID app, we could certainly go back and endeavor to get those numbers for you. But at the moment, as I say, it's a manual system, so it's a little uncertain as to exactly how long that would take. Certainly look for you.
Dr. Fitzgerald, it sounds like you wanted to pipe in there.
Yeah, I know. I was just going to say just a little more specifically. I think we have offered the code to probably 3 or 4 people who've had the app, and just over the weekend, one of person had presented as being notified by the COVID app.
So it is working. People should download it. For anyone watching at home, please download it and use it. Make sure it's activated.
So what does that say, though, about the overall use of the app, that we've only had 3 or 4 people that when they've tested positive out of the dozens that we've had since this app launched who've actually said, hey, I need a code because I'm using the app?
Well, it's a pretty small number to begin with, Peter. So we're encouraging more to use it, but just because the numbers are low, the uptake, it's hard to compare numbers in the denominator versus when you don't really know what that denominator is. But the main thing is the more people that use this, the more effective the tool will become. But don't forget, it's just one tool in the toolbox that can help prevent community spread of COVID-19.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I'd like to follow up on Peter's question there. Dr. Fitzgerald, did you just confirm that the app actually was triggered in someone as an exposure?
Yeah, so somebody had been notified that they needed to get, were a contact of a case. So
okay.
We've used it once in that regard.
All right. And I also wanted to ask something a little broader about a vaccine. People look at a vaccine as soon as it arrives, we're all going to be able to let go. But I mean, what would you consider? When would you consider to start relaxing health measures? Would it depend entirely on the number of cases?
With regard to the vaccine itself, I think there's a lot of things you have to consider. Number one, how many people do we have vaccinated? And, have we gotten through those priority groups that we really need to focus on, who are at risk for severe disease or who could pass on COVID to people with who would be at risk for severe disease? But in addition to that, then we have to look at what's happening elsewhere in the world and, how well are other people being vaccinated and things like that. So It's not just as simple as cases, and it's not just as simple as the number of people we've got vaccinated.
Okay, thank you.
Our next questions are from Linda Swain with VOCM. Please go ahead.
I noticed that Eastern Health has introduced a respiratory assessment clinic, or a series of clinics. What's that all about? Will other health authorities follow suit?
Dr. Haggie?
Sorry, I was on mute. My apologies. That is to deal with, I think, the issue of concomitant arrival of flu at this time of the year. They have decided to adopt this. We'll certainly see how it pans out. It is the more populous area of the province, so its utility in more rural areas might be open to discussion. But again, this is an opportunity to see how this clinic runs in Eastern Health and to see if it's of use in other urban areas across the province. So it's kind of like a demonstration project.
The tourism industry is seeking a back to normal plan. They want to know what the resumption of travel to the province will look like once there's a vaccine in place, for instance. And they want to know, will there need to be a proof of vaccination, testing either on arrival or on departure? When can we expect to have some kind of a plan of what that will look like?
Well, we've had good conversations with H&L and other tourism operators, and everyone is, of course, looking for a degree of certainty with the upcoming tourism season, and there's no one who can promise a degree of certainty. What we have promised is to work with them to inform them about different elements that will go into the key decision making, and some of them are quasi predictable in that, vaccine. Others are not, like when the level of epidemiology and community spread in other areas of the country and adjacent provinces, et cetera. So we've committed to working with them as best we can to provide the level of certainty that they'll need going forward. But again, that's based on probabilities, and there's no definitive the virus will end at this period of time. With respect to COVID passports, that's something that even the federal government is struggling with right now in terms of their ability to execute on it, what platforms they would need, how they would track it, the utility of it, if all provinces would be united in that effort. So these are all kind of questions that I know everyone is starved to hear the answers to, but frankly, the answers will evolve hopefully in short order, but will certainly evolve over time.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I've gotten a lot of questions surrounding the COVID-19 hub with the provincial's website. When it comes to listing how many active cases, when we were in our peak, it used to list the communities and how many active were in that community. Do you see us going back to that format?
No,
I would suggest that that's a possibility, Kellyanne, yes, because I think one of the things is that originally that was put out there simply because of numbers. The amount of work and preparation that goes into providing the biographies of the 4 or 5 cases that we have is significant. And there has been a request for us to return to that hub. I think the concern is when the numbers are really, really low, that leads to identifying of individuals. I would hope that we never get to the stage where the numbers are great enough that we would do that. But given the comments I made in my introduction, I can see we're well on the way to doing that. And that's certainly something under consideration in the department, actually, as of discussions this morning.
Thank you. And Dr. Fitzgerald, when it comes to talks around a vaccine and how it would be distributed and administered here in Newfoundland and Labrador, there's a lot of people who have anxiety and serious questions around a vaccine, many wanting to hold off for some period of time, knowing how quickly a vaccine came together. Do you have any advice for these people?
So certainly the development of a vaccine, there is a process that's involved in that, and normally that process is very drawn out. So, the research and development happens before testing happens, before manufacturing happens. Because these companies are developing, they need to make sure that it's worth their while to move to the next phase. With the vaccine for COVID, the development was such that those processes could overlap. And that was because there was a commitment from many countries in the world to support that. There was a commitment for funding, so companies were able to do the research and the testing and the manufacturing. They could all overlap at times when they normally would not. So yes, it may seem that things have come together quickly, but I think the reason for that is just because of the the importance that we as a global community put on the development of a vaccine. The same rigorous standards are in place for vaccine approval, so there still has to be proof that it's safe, proof that it works, and that hasn't changed at all. So it'll be, any vaccine that comes to the market that Health Canada approves will have gone through all of those rigorous standards and will be safe to use.
Thank you.
I will now go back through each reporter to see if there are any final questions. Peter Cowan with CBC. Do you have any final questions?
I do. Premier, I want you to elaborate on something from your opening remarks. You mentioned that people shouldn't panic. Why do you think it is that you're seeing a lot of fear, really, in places like Deer Lake? And what do you think needs to be done in order to tamp that down?
Well, I think people are, like all of us, we're watching, the world is just one channel away these days, or is one click on your phone away. So everyone is seeing cases, and I mean, you can see the death count, as morbid as it is, live on CNN and a live tick. So I think people's anxieties are escalating as we feel the pressure and the burden globally and across North America. And then, of course, as it moved north of the border, and you see the cases as the cases uptick in Alberta and other jurisdictions moving east, people feel that pressure, that virtual tsunami, as Dr. Fitzgerald referred it to, over just off our shores. But and as it can get local as well. As Dr. Haggie referred to, seeing people on social media targeting individuals, targeting suspected individuals, and that can lead to, of course, local anxieties and fears. So I think it's very normal for all of us to feel this way, me included, everyone I'm sure on the panel included, about the anxiety about COVID-19 being close. But it's also a time in crisis to take your own pulse, take a deep breath, and recognize that the public health measures here in Newfoundland and Labrador have worked very, very well. When you compare our numbers to across the country, we are definitely doing far better than elsewhere. Of course, we're going to have pockets that occur, and every now and then until there's a vaccine. But this is the time to, again, stay calm, don't panic, and evaluate public health advice. If we continue to follow Dr. Fitzgerald's advice and guidance, we will get through this. And there is hope on the horizon. We're so close with a vaccine just around the corner. Continuing with public health advice and vaccine distribution will eventually be what gets us back to normal. And then we can all take an even greater breath and have a celebration when it's done. But we're not there yet. So now's not the time to panic. It's the time to stay calm and continue to follow the advice. When we look in the rearview mirror, that's been proven to work.
And my final question, I just want to follow up on a bit of a disconnect. When you look at the official limits, the limits for gatherings are either 50 if it's informal or 100 if it's organized. Are we looking at reducing those going into the Christmas season based on what we just heard today, for example, talking about there shouldn't be, large Christmas parties. There shouldn't be seeing more than 20 people.
So those discussions are certainly ongoing, and we'll have some more information about that, I'm sure, in the coming days.
Okay, thanks.
Peter Jackson with the Telegram. Do you have any final questions?
Yes. I just wanted to get a sense where you see the trend that has been going the past few weeks. We've seen everything from 0 to 1 to 4 cases. Do you have a sense that the curve is starting to rise, or is it flat? What's your sense of it?
So I think we have to remember that all of our cases to this point are either imported cases or close contacts of those imported cases. And I think, certainly we're seeing an increase in the number of imported cases that we have, but that is not at all unexpected, given the situation elsewhere in the country and around the world. So, what we're seeing is what we would expect to see at this point. Whether we start to see a rise in, with regard to community transmission, an increased number of cases, a second wave, so to speak, I think that will depend very much on how well we are able to follow those orders, those special measures orders, and the public health guidance that's been put in place. Certainly looking at keeping our contacts as low as we can, and trying to make sure that we are practicing physical distancing, wearing our masks when we're out in public, continuing with self-isolation as we should. All of those things will be very important in determining where that curve goes.
Okay, thank you. That's all I wanted to ask.
I was expecting some math here. I was ready to do long division, Peter.
No, I'm just disappointed that you're allowing the surveillance elves in. I'm glad they didn't have them around without but that's fine. Thank you very much.
Linda Swain with VOCM. Do you have any final questions?
I do. We have 36 active cases in the province. The Premier indicated at the top of the briefing that it may feel like we're slipping back to March. Do you anticipate a rollback on alert levels before Christmas? And if so, what's the criteria in determining any changes?
So right now, as things are right now, I don't anticipate that will be the case. There may be some changes. As I just said a little while ago, we're talking about gathering sizes. So, there are things that may change, but I think, prediction is not really where we want to be at this point. So the most important thing for all of us is to just make sure we follow those tried and true public health measures and reduce our contacts as much as possible.
Thank you. And Kellyanne Roberts with NTV. Any final questions?
Yes. With what we've been hearing for the past several weeks from government itself is that if you can work from home, this message hasn't really changed throughout the pandemic. But government itself has probably 70% of the workforce that could work from home, but they're required to report to their buildings unless they have a medical exemption. And I'm hearing a lot of concerns from these government workers. I'm just wondering why this is the mandate right now.
Well, there would be protocols in place government is a large organization with different office spaces and different setups, so there are protocols in place, and presumably they're being followed. I would hope they're being followed, and if they're not, I'd encourage people to let us know. But it's to comment on specifics would be difficult without knowing the violation of such. But Dr. Haggie, I'm not sure if you have any kind of further information surrounding work from home.
No, I think we have said all along that if you can work from home, it would be preferable. I think the front-facing services from the Department of Health point of view have resumed at a level that is manageable in a COVID-friendly way. I think from the point of view of policies across government, we've certainly been working with Human Resource Secretariat, who set the standard for government to see what the art of the sensible is. There are some liability and ergonomic issues with people's houses not necessarily being designed as workplaces, and we continue to work through that internally within government. But I think at the moment we're not necessarily in a bad place, although certainly I've learned personally that I can do a lot of what needs to be done through the department in a way I hadn't anticipated 10 months ago.
Right, and touching still on this, essentially working from home, a lot of staff with the CNA are concerned about having students come back in January, although MUN is still online. Just wondering why CNA is going back.
I can't comment on. Yeah, go ahead, Dr.
Sorry. I would suggest you ask CNA. As long as they follow public health guidelines, how the education and the courses are delivered is down to the educational institution itself, unless they've had some discussions with Dr. Fitzgerald I'm not aware of, but I don't think that's been the case.
Dr. Fitzgerald?
No, I have nothing to say other than what the minister said.
All right, thank you.
Thank you, everyone. Premier, do you have any final comments today?
Thanks for joining us today. I'd like to continue to echo Dr. Fitzgerald's comments to just, instead of assuming COVID isn't here, you have to assume that it is everywhere and continue to obey public health guidelines. And together we'll get through this. A vaccine is on the horizon, but we all need to reach together to achieve it. To anyone suffering from COVID-19, of course, we all wish you a speedy recovery and support to your families looking after you. But together we'll get through this. Stay safe, look after each other and yourselves.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.